Okay, Tom, you're on.
In this day and age in America, we have no shortage of issues that keep us sharply divided, not the least of which is health insurance. From concept to methodologies, there can be no argument of the value of quality health care. The problem is how to keep it affordable for wage earners on all levels. Many proponents of the Affordable Care Act view it as a significant first step toward a single-payer plan. No cost or low cost health care for every citizen. Single payer is the federal government. The revenue source is taxation. Congressional Republicans who oppose Obamacare and presumably a national health plan have failed repeatedly to discard the Affordable Care Act, with each replacement measure aborted by insufficient support. Our panel tonight consists of Toms River attorney Michael Cooke, candidate for the New Jersey State Assembly in Legislative District 10, and Geoff Ginter, Pine Beach, certified medical assistant and healthcare activist. They both support the single-payer concept. The difference is how to reach it. Gentlemen, opening statements, please.
Well, I'll start. As Tom points out, I am very much for single payer. I think that's where we're going to end up. Many countries that have started with a single payer system have gone to something more somewhat hybrid, with the government paying for most care, but also allowing private citizens to buy into other kinds of insurance. Medicaid and Medicare were originally enacted with the idea of moving eventually to a single-payer system. At least that was the idea. Max Fine, who's the last surviving member of John F. Kennedy's Medicare task force, was recently interviewed in The Intercept and said that it was always the idea to start with the low-hanging fruit of the debate, elderly people who were profoundly without money to pay for health insurance, and the idea was to move towards the center and to fill in the gaps until a point where everybody was covered. The Affordable Care Act has the DNA of the original Medicaid, Medicare enactments, in that the idea, and this was sold to progressives at the time, was we were going to start with a lot of subsidies and eventually we're going to expand and move towards the point where most people receive their insurance from the government, if not everybody. It has the mechanisms for funding. It has, as features, Medicare and Medicaid, who have deep experience on how to care for people and how much these things cost. There's an institutional memory there that I think it's important as we move to a single-payer system. So that's my argument in a nutshell.
I have great respect, for people that want to move with the ACA. Great respect for people that want to move incrementally, who think we need to work within the existing framework. And I would definitely say that from a certain perspective, the ACA is the law of the land, and we have an administration that is currently trying to kill it administratively, which is political and humanitarian malfeasance. And that must be called out, and it has to be stopped immediately. One of the fundamental jobs of the President of the United States is to uphold the laws of the United States. Doesn't matter if you like it or not, that's your job. And Donald Trump is currently not doing his job. So that's the first thing I would say about that. Having said that, the ACA is still a for-profit, market-based solution for healthcare. And you cannot be more immoral about that. There should be no thought about profit when the idea is to cure disease. There's a myriad of ills that are created when the final product is not your health, it's how much money can be made off of your sickness. So I have no actual sympathy for the ACA. It simply is the law of the land and must be upheld. But we need single payer. We need single payer that is divorced of all thoughts of profit margins. That is the moral argument. fundamentally speaking, it has been said, how do you pay for it? The federal government does not pay for programs with taxation. That is not how it works. The federal government is a sovereign government with a fiat at-will currency. It creates money. Business does not create the money, and therefore you earn it and then have to pay it through taxation to the government. The government creates it, distributes it amongst the population, and you earn it from businesses, and then you pay some of it back via taxation. We do not raise money before we go to war. We do not raise money before we give money for disaster relief. Congress merely authorizes the spending, and the Fed electronically debits the accounts of those that will receive it. That's the way it works. This is the way it works for war, and it can, should, and must work that way for social programs. Social Security is not going bankrupt. That is a lie. Social Security is simply a program. And the federal government can fund it fully, fund it on time, can give them a pay raise if they wish. It's not about money. It is about resources. You want Medicare for all? You want it right now? The only obstacle is resources. Do we have the hospitals? Do we have the doctors? Do we have the nurses? Do we have the technicians? Do we have the infrastructure in real resources and people and manpower to be able to provide Medicare for everyone? If you are living on this planet, you can have health care. You can have it if we have the resources. It's not about money. The argument about money is for people that want to make money off of you. If you're in debt as a private citizen, that's a problem. The federal government does not have that problem because it creates the money. You want to create US dollars in your basement? That's counterfeiting. The US does it every day. So this is a moral issue. While we discuss whether or not the ACA should be expanded, people are dying. Harvard did a business study, did a study about healthcare in 2009. 45,000 people die every year due to lack of access to healthcare. I mean, 630,000 people have died since 2003 when the original H.R. 676 was first introduced, expanded Medicare for all. 630,000 people have died already for a preventable cause that we can fix right now. Congress simply needs to have the political will to treat healthcare the way they treat war. It's about resources. It is not now, nor has it ever been about money. Not since 1973 when Nixon took us off the gold standard. That is my opening statement.
Geoff, let me ask you first off. You give it in such crystal clear terms.
Mm-hmm. And black and white.
Absolutely. To your knowledge, has this been attempted in the United States before?
No, because the United States has been very slow to catch up to the idea that when Nixon ended the gold standard in 1971, we still treat the economy like money is tied to something. If you're on a gold standard, you absolutely now have a restriction. You now have a limitation. You have to be able to have enough gold for that money to mean something. Okay? If you walk into the Federal Reserve and you're going to be able to give them some money, you're expected to be able to get gold in exchange. Well, we don't do that anymore. The Fed does not give you gold in exchange for your money. You walk into a bank with a $10 or $20 bill, you want to change it for something, they're going to give you a 10 and 2 5s. They're not going to give you gold unless you want to purchase something. And the only thing you're going to purchase at the bank is other forms of currency. You want to buy gold, you got to go somewhere else. Mm-hmm. We're not on a gold standard anymore. But the difference between you and I, or a state, or a municipality, going into debt, you have to pay back that debt, and you have to pay the interest off of it. And you have to pay that to a bank or to some other entity. When the federal government spends more into the economy than it takes back in taxation after the fact, there is no actual problem. What happens is, reflexively, since it started when we began this country, if we run a deficit, if we spend more than we take in with taxation, we sell bonds. People buy those bonds. Individuals buy bonds. Businesses buy bonds. And yes, foreign countries will also buy bonds. We are the repository of the world's savings accounts. That is what we are. A depository of savings accounts. It's not debt. It's savings accounts. So, when you have a gold standard, you have to pay that money back. Those are actual concerns. But in a fiat currency, where the money is not tied to anything, the currency is tied to nothing, the federal government can simply electronically credit accounts. You have some bonds, you want to cash them in. You can only cash them in for US dollars. And the federal government owns the monopoly on US dollars. They can never run out of money. They can never be unable to pay their bills. Not once, unless they put on a constraint of their own, like the debt ceiling. The debt ceiling is a creature of the gold standard. Selling bonds is a creature of the gold standard. We don't have to have either one. We can choose to have them. We can choose to put constraints upon ourselves. But the only true constraint is resources.
Mike, can you address that? Because one of your key points was funding mechanisms in place.
Well, regardless of where the money comes from, and that's an important part of it, and I don't want to go too far into the economics part of it because I'm not necessarily competent to. But part of the float, which you're talking about, since we've gone off the gold standard, is the government puts money into the economy, and right now we're almost at for a while we were at negative interest. Now I think we're at a little bit of an interest rate. So the whole point is you put money into the economy, people spend it, and the companies have to give it back with interest, and that's how it sort of that's how you grow that's how the economy actually grows. But you're still faced with how do you distribute the money to through the system, through the government, through the system to pay for the different things. And I agree with you that it is a moral dilemma that we're not providing coverage for everything, but actual healthcare to people.
Forget about coverage. That's the one thing
there was a statistic I read the other day. Only 60% of all people who have HIV are getting antiviral treatment. Mm-hmm. And this has been something that the medical community has known for a while, but the CDC has only recently admitted to that people who are treating their HIV properly are effectively, most of them, without any detectable disease, and therefore cannot transmit the disease to other people, which you should still obviously be careful. But they're convinced that if everybody got treated, they could probably get rid of HIV in some finite period of time. Certainly quicker than they'll get a vaccine. It's within the realm of possibility. Mm-hmm. But we're only treating about 60% of all people, and a lot of those people are getting their medication through the insurance company or something like that. But the important thing about the ACA is that right now we have the institutional memory and knowledge of the Medicare and Medicaid of how to treat these people, how much it costs to treat people. The other thing that we need, reason that we should work through the ACA is right now, if you were to ask the government, how much money do you have to make to not be in poverty? The answer for a family of four is some ridiculous number like $20,000 to $21,000. Mm-hmm. It's been as low as 19 recently. That's maybe some places, but it's ridiculous. You're not, Mm-hmm. The great line I remember is, it's not that we've got, a third of all children are in poverty. It's the fact that the federal government seems to think that somebody making $20,000 a year with two kids is doing okay.
Yeah.
So
because they have a fridge.
Right. So part of this is looking at the whole government system and how what we really believe to be poverty and how people, how much money people need to live. We also have to look at taxation generally because we're, taxing people on money that actually should probably be, it's money they actually need and not excess. And mm-hmm. We're not doing that at the top end, we're doing it at the lower end.
Absolutely.
But also, that's a good opportunity, the ACA is a good opportunity to be realistic about what people need to live and what people can actually afford health care. You take the ACA, you have a benchmark, a standard of the care that you're providing now, and people aren't happy with it. And mm-hmm. I acknowledge that. And people, one of the biggest myths is that a lot of people lost their doctor or lost their health insurance, but it wasn't generally as a result of the ACA. A little more complicated than that. But we have got the complaints on the ACA. We know the improvements
Sure.
we can make to make it better, and also to lower the cost to the individual people, and then also work our way towards reducing the actual cost of health provision. And the great original sin of the ACA was not having the public option.
Yeah.
The Medicaid could really be the public option. It could be the buy-in, and states are already looking at experimenting with offering Medicaid for hire, to buy into Medicaid. If we offer that, slowly but surely, we're going to see companies move out of the business of providing health insurance. It's not going to be lucrative anymore. So we'll actually be using the profit motive the other way around.
I get that. I simply can't support it. Because as I said, it's like asking those who have been downtrodden, asking those who are the victims of injustice, just hang on a little bit longer. It's not the right time now for you to have your justices redressed. I don't subscribe to that. Injustice is injustice. You take care of it now. It's always the right time. Now is the time. If it's not going to be ready now, then it's not worth doing.
Well, and I also think that the ACA, if we do the ACA now and start to improve it and expand Medicare and Medicaid, we actually make improvements faster. Because let's be real here. Last year, Bernie put up the bill. Bernie Sanders, for those who may not know. Mm-hmm. Bernie put the bill up and got no support. This year he got 16, which is amazing. It's remarkable. Sure. It says something about the state of the Democratic Party right now. But and that's it, only in the Senate, and I would say almost every single Republican is probably going to vote against it. We don't even have all the people on our side.
That's because all those people that you're talking about still think that Medicare has to be paid for. They still think that it has to be done via taxation. The Republicans think if you want to have a Medicare for all, you're going to have to get rid of other programs. And the Democrats are saying, no, we have to raise taxes. We don't have to do either. It's very important that we all get behind this very basic idea that the U.S. is a sovereign nation. It owns the monopoly on the U.S. dollar. There is no way it can go bankrupt. There's no way it can become insolvent. This argument about how do we pay for something is ridiculous. The argument to be had is not where do you get the money from. We know where the money comes from. Every time we want to drop a bomb on someone, we know exactly where the money comes from. It comes from the authorization from Congress to do it. We know where the money comes from. What we need to do is make sure that everyone knows exactly where the money comes from. The government is not like a household. Every time a Democrat or Republican gets up in front of a television set and says, you wouldn't run your household this way, you can't expect the federal government to spend money it doesn't have. That is completely lying to you, to your face. That's what they're doing. They are counting on your belief system that if it works for you, it will work for the government. And if it doesn't work for you, it can't possibly work for the government. They want you to believe that one is the same as the other, and it's not.
Right. And it's a fallacy in the sense that I don't entirely agree with your analysis, but it is a fallacy. Two things. Anytime somebody in the government says, well, we can't afford that, it means that they don't have the, quite frankly, guts to ask the people who have the money to pay their fair share. That's A, in terms of taxes. B, yes, whenever they want something, they can find the money to do it. It's a matter of priorities. And C, A, B, C, anyway, it isn't the same as running a household, because if you're running a household and you're a little short one month, you might have to figure out how to find the money, but you don't just stop paying the mortgage. That's the whole debt ceiling debate. Well, we're not going to. We're going to maybe let the government go into default. Well, that's not.
That is a constraint placed upon them by Congress. That's still a relic from the gold standard.
Right, and that's not. I mean, that's sort of not running a government like you want to run a house, because you wouldn't just stop paying your mortgage. Mm-hmm. I mean, some are forced to, but we're not really in that position. But yeah, these are priorities we could decide to make. And if we can always borrow the money to pay for it.
We don't need to borrow the money from anyone.
We do, because when we issue bonds, we're borrowing money.
We're borrowing from ourselves. And if they want to cash out, the federal government just simply credits their account. The only issue, if something is for sale in U.S. dollars, no one can outbid the government. Fine, we have trillions of dollars in quote-unquote debt. They're also called savings account at the Fed. They're savings account. Someone wants to cash out. The only thing they can cash out for is U.S. dollars. If they wanted to cash out for gold, that's a problem. They want to cash out for U.S. dollars, that's a keystroke. You want to cash out your $20,000 in U.S. bonds? Not a problem. We will credit your account electronically $20,000. It's not a problem.
May I interject one thing here?
Sure.
At this juncture, and if this is not an intelligent question, call me on it. We've spent all of the time so far discussing how to pay for it. So can I look at it from the other side for
Sure,
a second?
absolutely.
In an ideal scenario for either one of you, and I'd like to hear from both of you on it. In an ideal scenario, would there be constrictions placed on big pharma, big medicine, and would there be, and big insurance?
Well,
And-
either way,
or is it carte blanche to just charge whatever you want because
The federal
there is no
government can
budget?
afford it.
right. Well, a couple interesting points about that. First of all, either way, we've got to empower Medicare or Medicaid, the federal government, the VA, to negotiate drug prices. They're right now forbidden under the ACA, and it actually has nothing to do directly with the ACA. It's just a law that they passed some years ago. Actually, I think it came up with Part D. They decided to prohibit negotiating drug prices. As far as the big insurance companies go, eventually, the idea is if you drive down the cost enough, I think eventually they'd find some other business to get into. But this is why we need the public option or the Medicaid buy-in option. But yeah, as far as there being carte blanche to charge whatever, we do, and it's priorities. The argument I've heard, where we were hearing in 2010, was from the doctors, like, well, there'll be rationing and there'll be.
We already have rationing right now. I don't want that.
Well, we
argument. No, I'm sorry.
But hold on.
We already have rationing. It's called 45,000 people that die every year. It's talked about me being in an office having to argue with an insurance company to make sure they get a procedure that the insurance company wants to deny.
But
we already have everything that they're talking about. We already have.
But if they think there's going to be rationing, or somehow the doctors aren't going to get paid enough, which is the other complaint, I give you the military-industrial complex. There is a government entity that is controlled and paid completely by the government, obviously, because you don't have your own private armies generally.
We're working on it.
Right. So that is not starving for anything. Now, I would, we would like to spend, I think, a little less on the Pentagon and have a little more efficiency there, and hopefully not need them as much. We need them now, obviously. However, I don't think the concern would be that the rationing isn't the concern that I think a lot of people were thinking of at the time. And as far as efficiency goes, and can the government handle something so large? Well, the military does a pretty good job.
Exactly.
The greatest, biggest military in the history of the world.
Just to talk about, the priority issue. Do we need to negotiate with big pharma? If money is no object, if the federal government can pay for whatever it wants, should we negotiate with big pharma? Should we negotiate with the medical manufacturing companies? Yes, absolutely. Just because money is no object doesn't mean that we should be robbed at gunpoint. We should negotiate. We should set fair prices. I'm not saying big pharma shouldn't make a good living. They should make a good living. They're doing a good job. But if they're basically reaming you, ripping you a new one so that they can make whatever money they want, that's morally untenable. So we make priorities. And that's the big issue right now. We don't have a money problem. We have an empathy and a priority problem. We don't have enough empathy for you to prioritize your problem because I'm too busy making money off of your sickness. I want to make money off of your debt. I want to put money in the pockets of the military-industrial complex.
And I would say that at this point, the reason why I back expanding the ACA in order to get to single payer is that, for the most part, the people who the insurance companies are still getting paid the largest amount of their income from private companies who provide insurance to their people, to their employees. As far as the what they call the Obamacare, but the exchange insurance plans, that's a much smaller part of the population. It was sort of, I would agree with you, it was the bribe to get the ACA through. It was the honey that we needed to get the expansion of Medicare for the states.
But bribe for nothing.
It was the expansion. Well, no, it was also what we needed to get some of the requirements of better policies that the insurance companies had to provide. It was, so many other things. The 80% minimum of dollars spent to treatment over overhead. We had a good amount in that deal. It's got a pretty good structure. I think the idea to take it and expand Medicaid, expand Medicare, offer better treatment, offer subsidies to people who make even more than they make than we're offering it for now. Because let's be realistic about how much people really need to get by. Covering people. We've been talking about making the age for Medicare and Social Security higher. Let's make it lower. Let's go the other direction. Let's start to meet towards the middle. And I think given that we've only got 15 or 16 people on board, which is amazing given where we were just a year ago, and we're definitely not going to make up the number that we needed to get to at least 50 or really 60, even in the Senate from the Republicans. I think we get closer to single payer and full coverage with the ACA in the near term than we do with, if we can magically do single payer
but
tomorrow.
But the thing is that we can do single payer tomorrow.
Yeah.
And it's not magic. It is political will. The politicians either know what they're doing and are complicit, or they have no business being in that office. It's a priority issue. Medicare for all allows everyone to live, allows everyone to have coverage, allows everyone to go to a doctor, any doctor, all doctors. There is no limit to what we can do unless we put a constraint upon it. All the issues that you hear about in Canada and the waiting time, that is a financial constraint that they place upon themselves. If you don't like the Canadian system, put more money into it. If the Canadians want to, they will. It's not about money. It's about priorities. It's about resources. It's about can we. We need to stop talking about how do we pay for it. That's not the issue. We need to start having the real conversation about what are our priorities. What do we believe in? What kind of country do we want to live in? Do you want to be an entrepreneur and you've got a family and several kids? You can't do it because you need the health care from your employer. We need to get off that. It's immoral and it's unnecessary. We have the mechanism to do it right now. We simply have to have the political will, and we need to educate people, wake them up. The federal government is not like a household. You need to start talking to your media members. You need to start talking to your members of Congress. Make sure they understand the reality that they live in. It's not the same one that we live in. We can have this. We can have it now. It's the right thing to do. Now is the time.
Well, I think you need at least two more election cycles to even get there, because you're going to have to. You're only going to get. We're going to. Unfortunately, the Democrats have a fairly decent shot of losing some seats next time around, even with the current political climate. And we've got a lot of people up for election in the Senate. We've got to hope to at least hold that and maybe gain a couple. It takes several cycles to even when we can change things.
Michael Cooke, attorney here in Toms River, and Geoff Ginter of Pine Beach. Two minds on the same track, going about it in different ways. Whichever you support, use your passion and think responsibly. Thank you for watching.
Thank you.